thank you for joining us in this session here. This is one that we've been particularly looking forward to, and sort of a lot has been leading up to this because, and if you're joining us online, welcome, or if you're catching up, welcome as well, and especially here in Singapore at SERI, thank you for being with us. Peter Holland spoke yesterday about the crisis in terms of refractive error. Half the world predicted to be myopic by 2050. So who is going to rise to these challenges? Well, one answer is the WHO, with a very important initiative indeed, and that is the SPECS initiative. And we are so grateful that we are not asked to represent that, but they actually be investing their time being with us firsthand. So thank you to Dr. Stuart Keel for being with us yesterday. It was a brilliant presentation, really grateful. If you're just coming in, welcome. This is a special session for the next hour with our colleagues at the WHO, specifically on the SPECS initiative. Very happy. I know how much Dr. Alarcos Ciesa enjoyed our Zoom sessions last year and was so engaged that has decided this is worth being here in person. So thank you very much indeed. I'm afraid our fireside chat's going to have to wait till next year, Alarcos, somewhere. But we're genuinely grateful to you for being here. So probably needing little introduction, but Dr. Alarcos heads the Vision, Hearing, Disability and Rehabilitation Department of the World Health Organization, and she is going to lead us through this. So thank you for your time and your energy. Please welcome to the stage Dr. Alarcos Ciesa.
Thank you, Oli, and welcome everyone to this session on SPECS. And this session will have four different parts. The first part will be just some reflections from my side, from a WHO perspective. Then we will go to the presentation, more formal presentation from Stuart. Then we will have a wonderful panel, and then we will go to you because we want to have your feedback, and potentially we will have some time for one or two questions. So let's start with the reflections from a WHO perspective. And actually, for these reflections, I would like you to keep three words in mind. And then when you think of SPECS in the future, associate these three words with it. The first one is immoral. The second one is platform. The third one is action. So everyone, a couple of seconds so that everyone does something in the minds so that you keep them in mind also in the future. At WHO, we talk about three immoral facts in public health. One of them is that after 100 years, the discovery of insulin, still not even 50% of people with diabetes 2 have access to insulin. The second one has to do with cardiovascular diseases. 1 in 3 of us has high blood pressure. Only 20% of those with high blood pressure had blood pressure that is medicated and it is controlled. And the third immoral fact in public health is that from the at least 2 billion people with refractive errors, only 1/3 have access to a simple pair of glasses or the other modes of adaptation that adapt or that compensate for the vision impairment. And again, the question has been in the last couple of years, how can this be? And SPECS is actually an answer to that question. What we are doing with the specs is really identifying all these different factors that are contributing to this immoral fact in public health, seeing how and studying how they belong together and interact with each other so that we can propose solutions that have an impact at country level. That is specs all about. The second word, platform. And I want you to think of WHO as a platform. And what we are doing with the specs, indeed, because it's using this WHO's platform in order to really do what we think is the right thing to do to address this immoral fact in public health. And the reason why we are doing that is because we are convinced that WHO is the right platform. It is the right platform because of our convening power. We can really reach out to experts, to leaders in the world, to scientists, and still people come to us and listen to us. It is also the right platform because of our neutrality. And I always say, look, for WHO, there is nothing else in this agenda than getting it right and moving forward and address this immoral fact. There is nothing else that motivates us but addressing this immoral fact in public health. And the third one is the third reason why WHO and why we are moving from a WHO perspective is because our link to governments. We only exist because governments, because ministers of health want us to exist, and we are part of them. The third word is action. And it is because, and it is not action, because specs is about action, but it is not action for the sake of action. It is really coordinated and combined action for health system strengthening and for system change and sustainable system change. And there is nothing more difficult. And all of you working in countries know that very well, and those working in ministries of health in countries know it very well, that there is nothing more difficult than sustainable system change. So that is what we want to achieve with specs, sustainable system change. So when you think of specs from now on, please think of coordinated, collective action led by WHO and with the WHO platform to address one of the immoral facts that still are out there in public health. And with these reflections, I would like to go into the more formal presentation of specs and give the floor to Stuart Kill, who, as you know, is technical officer at the World Health Organization in the iCare Envision program, and I'm very proud to have Stuart as part of my team. Stuart, the floor is yours.
Thank you very much, Alakis. Hi everybody, great to be with you here today to give you hopefully 15-20 minutes of an overview. So hopefully when you leave the room today you have a very good idea about what SPECS is and how we plan to move this agenda forward. And the first thing I'm going to cover, and I'll cover very quickly because Alakos really gave a good rationale behind why WHO and also why the SPECS initiative from a WHO perspective and why WHO is taking leadership in this space. Then I'll dig a lot deeper into the key elements of the initiative. What's the vision? What's the mission? What's the proposed engagement structure? What are the desired outcomes that we want to strive to see in countries as a result of this initiative and collective efforts from the sector and beyond? Then I'll explain a little bit about the Global SPECS Network, which is the platform in which we aim to bring together partners and organisations to work on this agenda together, and then outline the next steps. So the first one, why the SPECS network? Alakos covered this perfectly well. There is this immoral fact that only a third of people with a distance vision impairment due to refractive error have access to a good quality pair of spectacles that brings them to not being vision impaired. But the only additional piece of information I'll add here is the inequities and inequalities that we do have. So if we look at the income level findings with effective refractive error coverage, we can see that effective refractive error coverage varies vastly different from high income to low income settings. There's a six-fold difference ranging from 90% to lower than 15%. The key piece as to why WHO is taking leadership is that we know now there is for the very first time, there was a new global target on refractive error, and this is a very ambitious target. So if we consider the baseline figure that Alakos mentioned before, about a third of people, or 36% of people have access to a good quality pair of spectacles in 2020, we want this to be 76% by 2030. So that is a very ambitious target that we're trying to achieve. And we recognise that without concerted effort, without a multi-stakeholder approach, that addressing many of the challenges to scaling up access to refractive error care won't occur. Why WHO? Again, Alakos mentioned this, but WHO is the UN Specialised Agency for Health, and I think you'll all recognise and acknowledge that this is a very important health issue that needs to be prioritised. We talked about the convening power. We know a multi-stakeholder approach is required, and it now is the time to leverage WHO's convening power. This platform also enables inclusive participation, really building cohesion amongst stakeholders and strengthens the coordination impact of our collective actions as a sector. So now more into the meat of the presentation, looking at the vision and the mission. So the vision of this initiative is a world in which everyone who needs spectacles has access to good quality, affordable, people-centred refractive error services. And the mission is to support member states and other stakeholders in the field with the achievement of this 2030 target that we just introduced. To address many of the key challenges to scaling up access to refractive error, there are 5 key strategic pillars in line with the SPECS acronym. So I want to say that this initiative is much more than just spectacles. It is a comprehensive approach to strengthen provision of spectacles within health systems and beyond health systems. So the S stands for improving access to services, refractive error services. The P is the workforce pillar, about building capacity of personnel to provide refractive error services. The E is around improving population education. And with this, there's different components. There's the prevention aspect. There's also the increasing demand, which we know is a key issue. The C is reducing the cost of refractive error services. And the S is around strengthening research and surveillance. So what we have done is defined a number of desired outcomes for each of these pillars that we want to strive to achieve through this initiative, through the collective actions of this initiative. And it's a very busy slide, this one, that gives you an overview of those desired outcomes. But what I'm going to do now, I see you taking photos, we'll go through each of these pillars individually so that we can spend more time unpacking these desired outcomes that we have defined. They will undergo, we're sure they'll undergo more refinement as we get more feedback from the sector, and we've already had some great feedback from a meeting held last month. So looking at the desired outcomes that we want to strive to achieve in countries for the first pillar, which is services. First, let's touch on the challenges that we face, that we need to address. We know that there is limited governmental sector provision of refractive and optical services. We know that there's scarce service points for screening refraction and provision of refractive error services, predominantly located in urban centres and in the private sector. We know at the moment there still is insufficient cross-sectoral collaboration. We know that cross-sectoral collaboration with the private sector, the education sector, and so on is extremely important. And the government sector, we know, has little experience with the supply chain of spectacles, which links back to the first point, and the majority of services being provided throughout the private sector. So there's 4 key desired outcomes that we have defined that we would like to see in countries. And the first one is implementing policies for spectacle provision in the public sector. This includes, for example, provision of reading glasses in primary level facilities, provision of optical services within government facilities at higher levels of care as well. The second is, as we move towards governments taking more responsibility of providing services and procurement of spectacles, we need to set minimum quality standards for spectacles. We need to integrate procurement and inventory management within countries, and integration and strengthening refractive error services within primary health care. And this involves, again, primary level facilities, but also community settings such as schools, such as the workplace, such as the programs for older people, for instance. Looking at the second pillar now of building the capacity of personnel, we know one of the key challenges to scaling up access to refractive error services is simply there's insufficient availability of qualified human resources to refract, prescribe, and dispense spectacles. So there's also limited career paths within public health systems for these services, and there's relatively limited government oversight and an unregulated private sector at times, which can impact on the quality of services. So there are 3 desired outcomes that we have defined here that we want to see in countries, and that is regulate and increase the workforce that provide refractive error services. So the regulation aspect, of course, is important for quality, but we need to make sure that we're not reducing the workforce in that endeavour and the workforce is actually increasing. The second is standardising training programs for refractive error, again, coming from a quality perspective. And the next, we know that innovation is growing rapidly in this space, and we need to foster innovation for screening and refraction. And this is quite cross-cutting. We know telemedicine, we know auto-refraction devices, but we also know for myopia treatment, innovation is moving ahead very rapidly. Moving to education now and improving population education, the key challenges that we face are really a lack of awareness and commonly poor demand of refractive error services, even though these very cost-effective, cheap at times, for instance, reading glasses exist. There's misconceptions, stigma, compliance issues still in some parts of the world around spectacles, and we can't forget the impact of high myopia and the prevention component to that, which is now emerging as a leading cause of irreversible vision impairment in blindness in some parts of the world. So the desired outcomes that we have defined to achieve in countries here are implementing public health campaigns around refractive error, including myopia, focusing on prevention, focusing on lifestyle behaviour changes, aiming early on in life to really address those lifestyle factors. The second is including eye health in wider health promotion. This includes refractive error. There's a lot of links that we could have with obesity programs, with physical activity programs, with other programs to link eye health within these wider health promotional activities in countries. Implementing policies for myopia prevention in schools. We've already seen good examples of this in the country that we're standing in at the moment, that are mandating set periods of time for children, younger age children, outdoors during school hours for prevention of myopia. And increasing population demand for spectacles, of course, is very important. The second last pillar of cost. The key challenge is simply that cost is a huge barrier to people getting access to a pair of spectacles. Spectacles are very rarely included within health services packages and insurance schemes in countries. And there are a number of trade barriers that we see. There's trade barriers related to import duties, long processing times, taxes, and large markups of cost along the supply chain. So the desired outcomes we want to see in countries are including spectacles in health services packages and insurance in countries, at least for segments of the population, such as children, such as the vulnerable populations, which of course varies by country. Addressing the trade barriers, we know that this is not a one-size-fits-all approach to addressing the trade barriers, and establishing sustainable financing mechanisms for government provision of spectacles. And the last pillar is strengthening research and surveillance. So we know data on refractive error in health systems, in eye care, but also in refractive error specifically, are largely lacking. Therefore, it is very difficult for countries to plan in an evidence-based fashion to address the issue. So we need to robustly monitor this global tracer indicator we mentioned on effective refractive error coverage. And there's also a need on the ground to implement quality assurance programs as well. So the desired outcomes that we want to see in this pillar are integrating refractive error indicators within health information systems. This has been a challenge given the majority of services are provided within the private sector, but moving forward, this needs to occur. Periodically collecting and reporting on the global target, and as I mentioned, implementing those quality assurance programs. So that's a bit of a deep dive into the actions, the desired outcomes that we want to strive to achieve in countries. And now, how are we going to do that? So this is the engagement structure that has been developed to help support the achievement of the desired outcomes. So up the top, we have the central WHO initiative that will be housed at WHO and led by the Vision and Eye Care program that sits within the NCD department. Then there's 3 separate areas of engagement to help support the mission and desired outcomes that I've just gone through. Starting from your right, the WHO specs normative work. The WHO specs normative work will be in WHO's normal functions to engage with experts to develop technical tools and resources to help support countries and stakeholders with implementing those desired outcomes. The WHO Global Specs Network is a network of stakeholders with a common vision to promote collective and coordinated advocacy towards the achievement of the target. So really a platform to promote united action and coordinated advocacy. The third is the WHO Specs private sector dialogues. So WHO will engage in separate private sector dialogues to encourage meaningful contributions to scaling up access to refractive error services. So this will occur in a similar fashion. WHO has undertaken these dialogues in the context of increasing access to insulin and also to hypertensive devices. The process will briefly follow defining a series of asks to the private sector, undergoing a series of consultations until by the end of the consultations we expect to get contributions. These contributions will be made public on the WHO webpage and there'll be accountability mechanisms put in place. Looking at the normative work very briefly, I just wanted to provide an example of the normative work with one of the pillars to help support the desired outcomes for the education pillar. I just went through these desired outcomes. WHO will undertake a number of activities and normative activities, and that will include implementing the WHO ITU Myopia Ed program, which is a message-based program focusing on the end users and myopia education and prevention. Secondly, WHO will soon launch an app called WHO Eyes, which is an app to enable it's a population-facing app downloadable on iOS and Android that enables quite easy vision testing for near and distance at home and really builds in key health promotional methods. And we think this is a great opportunity to raise awareness and to also drive demand and health-seeking behaviours as well. And amongst this normative work, we'll also be developing educational materials and undertaking some more demand activities as well. But I want to spend the last couple of minutes looking at the WHO Specs Network. So the WHO Specs Network has 3 objectives, and the first objective is really to unify all stakeholders under a common vision of actions that are needed to achieve the 2030 global target on refractive error. The second is conducting evidence-based advocacy activities to increase support to WHO and to raise awareness on refractive error. And the third is to strengthen discussion, the exchange of views and knowledge sharing. So we understand that in this room and outside this room, there are vast amounts of experiences. So this platform provides the opportunity to bring these experiences together and share them amongst the sector. We'll also be looking at bringing in other partners from outside the sector, from different players as well, to see how these also linkages can be created and strengthened. So looking at the governance structure and the membership of the network, so there'll be a secretariat, a steering committee and the members. The secretariat will be WHO, and the role really to oversee the day-to-day management and the smooth flow of work in the SPECS network. The steering committee will be made up of up to 10 individuals that will be appointed by WHO, and they will then become chairs and co-chairs of the different work streams of the network that we'll see on the next slide. And then most importantly, of course, is the members themselves. And the members might be from intergovernmental organisations, bringing in organisations, other UN organisations such as UNICEF, such as ILO, such as the Universal Postal Union, for example. Non-governmental organisations, of course, academic institutions, the private sector. Here it won't be individual private sector organisations, but the constituencies or associations of the private sector or representative bodies of a particular private sector, and then philanthropic organisations as well, foundations I should say. So the last thing with the network is how will this network actually work? So work streams will be established with a specific topics of focus. And there's an example of 3 work streams that we have on the screen here. They're unnamed at this point. We're still getting feedback on what the work streams will be. There might be up to 5 work streams. This is yet to be determined. So the purpose of the work streams is really to bring together members of similar interests to share information and to work collectively towards actions. So each group will have a different focus area, and then the chair and the co-chair, coming from the steering group of these work streams, will then develop a work plan or draft a work plan that will include clear objectives, key messages, activities, a timeline, and clear indicators for monitoring the progress of the actions of the work streams. Next steps, very briefly. So WHO, you need to, I would say, bear with us. There are a number of actions that we can move forward immediately, but it is also very important at WHO. We've got one good shot at this to set the foundation at WHO to make sure when we kick this off, we can actually deliver. So we'll really be spending time building the platform at WHO and the infrastructure so that we can deliver this initiative. We'll be establishing a strategic advisory group to help guide this process as well. In the more shorter term, we'll be opening up, there's specific terms of reference for the network with all of the eligibility criteria for organisations to find who can become a member of the network. There'll be an open call for membership in the back half of this year. And there will, of course, be ongoing development and implementation of the normative work as well as part of our normal function. With that, I'll finish up, pass back to Alakos.
You also give us 2 minutes back. And one more thing that I would like to emphasize, we are sharing specs over and over again in different settings and fora. That is to get your feedback. We want to get it right. We want to identify what are, if you see any challenge that has been missed, any of the outcomes that has been missed, please, feedback. We need that. As Stuart said, we have only one shot to get it right. And with that, let's go to a wonderful panel that I would like to invite to the podium. So let's start. Sunrana Jasmine, Deputy Director for Programs, or Technical Deputy Director at Sightsavers. We have here, sometimes I have a blackout with names. Scott Mandel, who is the past president of the World Council of Optometry. And we have Komi Naidu, who is the head global health for advocacy and partnership at the One Side Xyloxotica Foundation. What I would like to start with is very quickly, each of you, something that you can tell from your professional past that the audience probably does not know. Very quickly, Sunrana.
Okay. Hi, everyone. So you might not know that before coming into the eye care sector, I started my professional life working with the comms agency and working with Ministry of Health in Pakistan to develop and implement immunization campaign focusing on polio eradication.
Okay, thank you. Kobin, very quickly.
As a former political prisoner and anti-apartheid activist, I expected to go into politics. I go to a conference, I talk about training optical technicians, I get slammed by the optometrist, but the next day a gentleman quotes me positively, he and I have dinner and we decide to set up a foundation and do NGO and do something about it, and that was Professor Brian Alden.
Okay, great, Scott.
Kind of along the lines of WHO specs, 30 years ago, a group of us, so optometry, ophthalmology, and opticianry in Canada, which we call the 3 O's, unheard of, got together to come up with a national strategy for vision in Canada. We missed the one kind of important part where government didn't know what we were doing and weren't interested, so I'm happy to say that now it's actually moving forward. So I take solace in the fact that 30 years ago we had that idea and it might actually see its fruition.
Good, after 30 years, or along the
Not a
way.
patient person, so.
Great. Great, thank you for that. So what I would like to hear from you first is a spontaneous reaction to what you have heard to specs. I'm going by default to Sunrana, please.
Thanks, Alakos. I think my first immediate impression is that as SPECS 2030, we have an initiative which has a very comprehensive and integrated approach that is not just focusing on the product, but has very strong components that are looking at issues of human resource, service development models, prevention, innovation, and data. And I believe that that's the lens that we have to apply to achieve scale when it comes to refractive error services.
Yeah, great. Thank you, Scott. A quick reflection?
Yeah, so basically having the WHO take the leadership role with their initiative instantly brings refractive error on the stage, and it didn't do that, but it wasn't available before and awareness of it before. So as you mentioned earlier, you can use the neutral platform that builds consensus and cohesion, use your convening power, but as those who may have attended the refractive error work group recall me saying, you guys have opened the door, now it's our job to walk through the door and say, we're here, this exists, here's the problem, we have a solution.
Okay, great. Thank you, Scott. Kobin?
I think the individual NGOs, etc., have done amazing work, but we haven't achieved the scale that we needed to. And the reality is that WHO specs is placing before us an approach that talks about scale, that talks about systems approach. And I think that given the disparities between the rich and the poor in our world getting even greater, there's a sense of urgency. We've had technical reports, etc., from the WHO, but I think this is a strategic approach to refractive errors that can catalyze significant change in the sector, and we should all get on board and make it happen.
Great. Thank you, Kobin. I stay with you. And actually, I want to speak at the Kobin in you, yeah? That is a public health professional that has been around for at least around 25 years. And what I would like to know is, what do you think is the most critical consideration to make a SPECS a success?
Just to clarify, I started at 10 years old, if you're doing any calculation. So for me, the major logjam, I mean, we've got affordable spectacles. We need to get them to be distributed. We can engage in demand generation. We've got some good examples in India and other places. But the issue that's preventing the explosion of refractive services, which is what our world needs, is the lack of human resources. Mm-hmm. And the reality is that all current approaches, and I want to emphasize, if we are honest with each other, that all approaches will take a couple of lifetimes to solve this problem. And however, the exciting thing about this is that there's technology, and technology integrated with human resources approach using telemedicine, etc., has opened up the possibility of us coming together and building something that can overcome one of the biggest obstacles in eye care in general, but specifically in refractive error services.
Great. Thank you. Thank you, Kobin. Now to you again, Sunrana. How do you think that civil society can contribute best and support best the SPECS initiative?
I think it's a great opportunity for civil society to engage with the SPECS 2030 initiative. And firstly, be part of it when the network call come in, apply, and if successful, then this is something where they'll be able to contribute towards design of those work stream and then be part of it in terms of implementing those processes as well. And most importantly, when it comes to advocacy, we know that civil society have been working in low and middle income resource settings for a very long time when it comes to refractive error services. So working with member states, ministries of health, and make sure that the recommendations from World Report on Vision, the tools and products that will be developed as part of SPECS normative work are integrated and implemented at the national level. And then also looking at that how then we can take that to the next level where sustainable service development happens and services are provided to the communities who need it. And most importantly, I think that is a great opportunity to just come together and collaborate and be able to deliver on what we have been trying to do for a very long time. Universal eye care access for all. People, kids who need classes, they have access to those classes.
Great, thank you. And look, Kobin mentioned it will be, something that will contribute to success is technology and the good use and implementation of technology. Anything that you would say will really be fundamental for the success of SPECS? You need to think, yeah.
I don't think. I think first thing that came to my mind was that inclusive participation. And that doesn't mean just people sitting in this room. It's definitely eye care sector and beyond. And then making sure that we are including communities in those discussions and taking their feedback into account as well.
Okay, yeah, great, thank you. Now, Scott, to you. One of the things that is really fundamental, and again, emphasizing for all of you, so we need to identify all the barriers. What is the barrier that you would really put the most accent in from those that you have seen, and if you have seen that something is missing, what?
Yeah, if you recall in Stuart's presentation, every pillar had 3 or 4 barriers. There's obviously lots of barriers, and if there weren't barriers, we would have solved this by now. So to think of which barrier I think is the one that I would spend attention on right now, obviously is also something that's in the developed world, and it's awareness and demand generation. So people don't know what people don't know. Everybody assumes that everybody sees like they see, so they don't understand that there's a problem until it's either pointed out for them. So to use Canada as an example, which some people may not say is a developed world, but we have national health care and children are covered. So by the public saying they call it free, but taxpayer funded care. And there's lots of touch points for kids as they come up, through the well baby checks, et cetera, that they're reminded to have their eyes examined. And even with that, the uptake for vision care for children is 14%.
Yeah.
So, and the amount of time and energy that's gone in to promote that is challenging. So,
yeah. I will come back to all 3 of you with the question whether you see any low-hanging fruits. That is important from WHO perspective now. But what I realize on the reflection that I have is that one perspective that is missing in the podium is private sector. And we have really one big component of specs will be the dialogue with the private sector and really have a dialogue to identify actions of the private sector. So what I'm wondering is whether someone from the private sector who is in this room could come up and volunteer whether there is, how specs resonate. Yeah, Juan Carlos.
Sorry, I'm overdressed.
Yeah, you, okay, look. Yeah, no, so it's.
But you dressed appropriately. You want to come on the
Come
stage?
in. Come in.
Come on, make up your mind there.
Okay. That is decisiveness in
Okay,
action, huh?
can you hear me?
Yes.
So is there a specific question or?
How does resonate with you? How does spec resonate with you?
It resonates, but clearly as one goes through this process, and this is not the first time that I've heard about this initiative, but the same issue that Coven brought up about the human resource component and the inability, we've been talking about this for many years, the inability to work with local government organizations at 3 ministry levels. Ministries of Education, Health, and Labor makes it very difficult to get the proper educational programs in place within the countries, within the developing countries that can provide these refractive services. So I am hopeful that through the World Health Organization that you'll have more capabilities to influence local governments at these 3 levels to make sure that those long-term sustainable educational initiatives are implemented.
Great. Thank you for
Okay.
those insights. Really great. Thank you for those insights.
Okay.
And it's spontaneous. So thank you
I've
for
been
coming
thinking
up.
about it for the last 40 years, so.
That is great.
You know, I know
I know.
Juan Carlos from Cooper Vision, and there are people here from Novartis and EssilorLuxottica, and I'm from National Vision, but there are some bigger companies here, and we've all been looking forward to what is the right way to engage with this. We come from a very different perspective, and I think your inclusion of the private sector and will help us to engage more fully and contribute more, given the structure you've set up there.
Great. Thank you. Good. Now back to you, Scott. I leave it with you. So
Low-hanging
any
fruit?
low-hanging fruit.
Yeah, back to the comment I made about the uptake, that the kids aren't getting examined, and they have all these touch points. So then you think of where's the next obvious touch point, and that would be the school system. So where you have a collective group of kids who are contained, hopefully, in a room. And that's something that actually Canada implemented a number of years ago, and it was called ICI Learn. And the key is to convince a government that it's in their best interest, and that's always the challenge from a cost point of view. But basically, providing this service in the school for kids for comprehensive care will pick up those ones that aren't covered. So it's pretty simple.
Great. Sunrana.
I think there is a huge focus on globally on primary healthcare at this stage. So integration of refractive error services and provision of spectacles within primary healthcare system and then at the community level can help us reach where we want to go. And this is something which is happening. Member states are in the process post-COVID rebuilding their systems. So there is an opportunity where we can make sure that this happens in a very systematic way and the right resources and investment is allocated for that as well.
Great. Thank you. Kobin?
I think awareness and demand generation can get us off track, get us on track very quickly. And I think that's critical so that the resources that exist can be maximally utilized. The advantage with refractive errors, we are not only talking now, given the myopia boom, we're not only talking about the underdeveloped world, we're talking about the developed world as well. And this is one of the most equal health conditions that exists out there. And by mobilizing awareness and focusing on awareness and demand generation, we would also be a very strong advocacy effect, because even the privileged will start seeing the value of investing in refractive errors. And that includes ministers and donor agencies in the developed world will get to understand that, because their own children are now affected, even probably more than a child in Africa, because myopia is affecting those who have better access to digital devices more than it's affecting somebody who has no access to it. So I think that can get us off the ground and elevate the profile of refractive error.
Great, thank you. Now I go back to the audience.
Wolfgang Indorfer, Light for the World. First and foremost, I truly appreciate that SPECS is coming up, and I think it's more than timely, because at least it puts the local governments into a driving seat and into an ownership, which I think so far never has been done before, and I think this is something more than timely, so I really appreciate that. I happen to have a bit of experience in Africa, and from those experience, and I fully agree with Covin, that one of the biggest challenges is adequate human resources on all levels, especially in the countries where most of us NGOs are working in. But from field experience at the same time, I realized that if SPECS wants or should become successful, then whether it is reading glasses, best vision spheres, and other corrections would need to scale on a much broader perspective and less away from the top or mid-class professionals, but more broader on a community level. At the same time, I could see that it is also difficult for the few professionals in those countries, those who are ophthalmic clinical officers, ophthalmic assistants, maybe optometrists, I don't know, Scott, but at least quite a number of those mid-level eye care providers make most of their living and most of their earnings because of prescriptions, but mainly also the distribution and dispensing of reading glasses and simple best vision spheres. So this is another aspect where I say, as a challenge, how can we make sure that the mid-level eye care providers in those countries are not going to be then sidelined or falling into a system whereby actually they would rather jeopardize the success of that and in rather to be taken on board to promote SPECS. Thank you.
Great. Thank you for that, actually another challenge, complementing another challenge. Actually, you didn't mention low-hanging fruit, but the challenge, what we appreciate, because we are looking for that. So any low-hanging fruit from anyone? Where? Yeah, please come up quickly. Come up quickly. One.
Good afternoon, everyone. Dr. Chimeze from Nigeria. I work with the Ministry of Health. So a lot has been said about awareness and demand generation. So I reaffirm what the previous speaker just said, which is there is need for human resource development, particularly for eye health in developing countries. And then secondly, I actually had a little question for Stuart, which is how do we reconcile SPECS with the targets for EREC, considering that most of the data we'll get for EREC may be from population-based surveys. So that is a bit confusing for me to reconcile.
Okay, you posed already, you went into the questions. We will go into responding these questions. Okay.
Thank you very much.
So if you see any other challenge, if you see any low-hanging fruit, please tell us. At this point, what I would like to do to manage well the time, potentially we will come back, is to thank our panelists. Great, thank you for being with us. And now I would like to invite Stuart again to the podium. because we want to make the point again that we want to hear from you, and perhaps you can also take some time at the end. We will take 2-3 minutes for questions, and then we can also answer that one.
Yes, thank you, Alakos. So, in fact, we want to bring you back to the WHO SPECS network, which was that middle pillar of engagement where organisations from a range of the backgrounds can become members. And the reason why we mention this is Alakos mentioned earlier that we have been trying to seek as much feedback on this initiative as possible. So the first round of feedback is we hosted a meeting about a month and a half ago in Geneva with about 30 individuals representing key stakeholders in the space of refractive error. And the purpose of this meeting was really to present specs and get as much feedback as possible. And we're very happy to say that we did receive some excellent feedback on the desired outcomes that we have refined on what the priorities should be for the normative work. But the last bit of feedback we received from this collective group was starting to think about what the work streams of the network would be. So the work streams is a longer list at the moment, but the potential work stream topics that were identified from this group are listed on the screen. They're workforce, and they're around many of the comments. So I'm happy to see that many of the comments are in line with the work stream topics. Workforce, awareness and demand generation, service delivery integration, research and innovation, legislation and regulations, sustainable national financing, cross-sectoral engagement, and product and supply chain. So what we would like to do now, and we didn't envisage before today that this room was in fact a black hole when it comes to internet. So what we wanted to do is ask you 3 questions. And those questions are amongst that list of potential work streams that I just presented. We want you to rank the most meaningful work streams that you think would achieve the objectives of the WHO SPECS network, if you remember those 3 objectives that I presented a little bit earlier. The second is on the far screen. Are there any work streams from this initial list that you think are missing and that you could add and provide some feedback to us? And the third is a very general question, and provide any additional feedback that you have on the broader WHO SPECS initiative in general. So as I said, we had set this up so you could scan this barcode. Those with data can still scan the barcode, but those that are using Wi-Fi are unlikely to be able to do so. So what we would encourage you to do in that case, scan the barcode, submit your feedback now for those that can. For those that can't, I would suggest that we take a photo of the barcode. We can also provide an email address that you can provide feedback to the team as well. So we'll give you a moment there to scan. I can see there's still quite a few able to scan that.
And otherwise, take a picture.
Yeah.
Take a picture and you can do after. Because that is really for us important. We want to have your feedback.
And if you can't scan, then we will please send your feedback to the email address on the screen.
And now, so let's have 4 more minutes for one question. We have a question, Stuart, before, and it's how we will manage with the data. Because all this data is coming from population-based surveys.
Yeah.
And then please, we will have time for another question, so come to the front if you have one question that you want to get answered. Stuart.
Yep. So you saw the mission of the initiative is to support member states with the achievement of the 2030 global target. And as I mentioned before, this is a very ambitious target that we're hoping to achieve by 2030. So this target is a tracer indicator to see how we're progressing in terms of access and also quality of services when it comes to refractive error. But it's not the only indicator that we should be monitoring and we should be implementing over this course. And I would refer to the broader eye care indicator menu at WHO for a more comprehensive set of indicators that should be implemented and monitored over time. And I would say that we have a challenge in front of us to also expand the facility, as governments take more responsibility to providing refractive error services. We need to implement these facility level indicators more broadly as well and standardise these. And we mentioned also one of the key aspects when it comes to data is the quality assurance and program monitoring on the ground. So all of those aspects need to be taken into place, but a tracer indicator for our progress is EREC.
Great. Thank you. Come to the front quickly. The last question.
Of Carl Zeiss. Therefore, I have also my opinion on how it resonates to the private sector, but it's not the question. The question now is, how does this link together with the refractive error advocacy group in IAPB? How is this all working together?
Yep, that's an excellent question. And one question, I'm very glad you asked that. So you would have seen in the photo a couple of key representatives from not only the refractive error advocacy group, but also the other alliances and groups that are in the field already, that are doing amazing work, the Coalition, iAlliance, many of the other groups that have been established that are doing great work. So we see this challenge as big enough, there's a big enough pie for everybody to work in, and what we are working very closely with these groups to make sure that our actions are complementary and there's no overlap. You'll see within the initiative and within these groups there'll be overlap in personnel to make sure exactly that we're working together in a unified way.
Great, thanks a lot. And how it resonates and low-hanging fruits we can discuss later.
Yeah.
Good.
Great.
So, and everyone got the message, I hope. So we want to hear from you. So please send your feedback. You can use the questionnaire that was presented, or you can send an email to Stuart. So whatever you think of challenges that were missed, actions that need to take place and that they are low-hanging fruits, or whatever feedback in addition you want to have, we want to hear all of those. So, and with that, I really thank again our panelists. Another applause, please. And to all of you for attending this session.